Hi, I'm Johnny.
And I'm Wayne.
Welcome to Planet Health. There's two recent Apple announcements in AI that I thought would be good for us to cover, even if we haven't had a chance to use it extensively. One is Apple Intelligence was just turned on yesterday for the public, but we can see how it works over the next couple of weeks, and we can come back to that again. The second is Apple actually released an interesting white paper around AI's inability to reason,
Okay.
which probably is no surprise given AI is a large language model. Reasoning isn't based on probability. It's a little different. And I've got an example, kind of what that means. They asked two different large language models to do a computational analysis on a word problem. ChatGPT and Llama did well in the context of the question when the question did not have any extraneous information.
Yeah.
This
Yep.
case, you see it like when they talk about, picking kiwis, they added one information around five of the kiwis were a bit smaller than average, which had nothing to do with how many kiwis does Oliver have in this word problem, right?
Yeah.
Both problems had the arithmetic wrong. They reasoned that they should subtract the number of kiwis from the count because the kiwis were smaller, but that doesn't change from the total count. So as we think about AI,
Right.
it'd be interesting to see kind of the practical applications. And the word of caution is that like these large language models aren't meant to reason. And there's probably a lot of reasoning and human checking that might be required,
Yes.
especially in healthcare, right?
Yeah, I think it's interesting that it doesn't pick up the actual equation, right? That's kind of basic, you would think. So that means that that language model doesn't really understand the context of the data it's in the word problem, right? I mean, this is essentially a word problem, right?
It's a pretty simple one at
Yeah,
that, right?
exactly. Right. So you would think that it would understand the context of the data so that it can make the right calculation. But if it doesn't do that and you start throwing extraneous information in, then either the model's not complex enough because, frequently in human speech, it isn't just clean information. It's, if you obviously listen to Trump, there's lots of garbage in there, right? So you would think that that would have been baked into the LLM, right? It would just say, okay, I'm going to hold on to this. Smaller or bigger doesn't matter because that's not the question, right?
I agree. What's actually shocking is the ability for large language models to process all the information on the internet and
Yeah.
filter out relevant information, but in like 4 or 5 sentences, it could not pick out the right relevant information. AI, one, I'm just very shocked that we have AI today. But two, just taking into context, like AI isn't yet ready to do everything. And the threshold to, ensure that the accuracy, kind of the interpretation data and applications of it, like,
Yeah, I think so. This is where I guess the issue is, right? If you start relying on technology, you start getting lazy, right?
mhm.
And right now, physicians are trained because they have their own, model in their head, obviously, of symptoms, age, context, and all that, and coming up with a diagnosis. I mean, the whole diagnostic process is very
Mhm.
embedded in your experience, right? So
Yeah.
a first year practitioner isn't going to have the same experience as a 20-year practitioner. So being able to sort of distill what that
Mhm.
extra piece is hard to will be interesting to see how quickly AI is able to pick up on that, right? What are the cues a seasoned practitioner is picking up on that the younger practitioner doesn't know yet or can't it doesn't figure out yet? And I honestly I don't know if the seasoned practitioner would be able to articulate like, oh, this is what I pick up. When medicine was in the younger days, you were literally apprentice instead of you didn't do a residency, but you were apprenticed to a more seasoned
Mhm.
healer, right?
Yeah.
And that healer would just give you all the knowledge that he or she
Right.
had to be able to let you practice the same way. And
Right.
we've distilled it into textbooks, but it's still a leap between what you see in the textbook and when you see a human, right?
Exactly.
What
Yeah.
are what are the signs and some because nobody really fits exactly into that, right? Into
Mhm.
whatever the framework is that you're looking at. So here is interesting because, like you said, we would once we got the data, we would look at it and we would see what Chat GPT comes up with, and then we would say, oh no, the equation is wrong. We could pick out the relevant data, but as you get more used to having this and start relying on it and
Mhm.
sort of saying, okay, well, whatever number they come up with is what we're going to use, you're going to lose your sense, right, of being able to discern what the real answer should be. This is the same issue that math teachers have with using calculators in the classroom, right? Because you still have to learn how to do basic multiplication, division,
Yeah.
before you use the technology, and then you could sense whether the number is close to the right number, and then you'll use it, or is it wrong, right? And in medicine, obviously, that is much, much more complicated because I think, like, what I think the AI is useful for is, let's say, if I have 10 articles that are, on a particular topic, it would be great for the LLMs to be able to summarize or pick out the things that are the most important most important
Mhm.
ideas, right? To help me read through all the
Yeah.
literature. But I should still read through the literature because it may come to the wrong conclusions, right? And
Yeah.
until I'm comfortable just taking the summary from an
Mhm.
AI tool, I think that's where the rubber will meet the road, where we'll be able to do that confidently and not lose
Mhm.
our ability to do the thinking ourselves, right? I mean, there's
Yeah.
one thing to outsource calculations, right? What computers have done, but it's another thing to outsource thinking.
Yes.
And in medicine, it's not just about the facts, it's about putting the facts together to draw a conclusion, which then ends up being what you base your treatment on. So I think obviously in early days, you still
Mhm.
kick the tires, you still have to make sure that the things are coming through properly. But given in this day and age where, there's a lot of pressure for physicians to see lots of patients and try to use as much of the technology that can help them be more efficient, we have to be careful that we are not substituting our thinking with what AI comes up with, because it's probably still too early to
Yeah.
trust it, right?
That actually speaks well to something that I recently read. So the American Medical Association had a paper around kind of the various levels of AI intervention in
Right.
health,
Yep.
which they broke it down to three stages. First was assistive.
Mhm.
So it's taking data and providing assistance around the analysis, interpretation of data so that we can expedite what we do. The second stage is what they call augmentative, which I think is the middle ground between assisting and fully
Thinking and thinking.
autonomous. Augmented is providing a certain level of thinking and analysis, but you still have to ensure that the physician has to read it, understand the
Right.
context,
Yeah.
and be the one to ultimately provide the diagnosis and treatment plan.
Right.
Right. And then we're definitely very far away at this point, just as I'm looking at this word problem, fully autonomous, right, in any application in healthcare.
Yeah, no, I completely agree. And I think those levels are a good way to sort of parse out what's available to healthcare right now. I think in healthcare, there's a lot of inefficiencies, right, that can be resolved or improved upon by use of AI, right? So the front desk answering the phones, answering questions about appointments and things like that. Just getting some basic information, that's probably something that AI can really, really help, right? If you can reduce the number of people needed to answer phones live and be able to talk to a chatbot that has all the appointments available and has your history of what your conditions are and could even check, let's say, your last fill for your prescriptions and things like that, that would be great because that's relatively simple, right? That's like an assistant. So you're asking somebody to get you coffee, right? There's not that many variables there. It's relatively straightforward and you can do that. So I think that level of AI is safe to use for patients. Now, the augmentative stuff I think is useful just because of all the data that's available, right? So ideally, what would happen is when a doctor sees you, you have all the information, the doctor has all the information that's available electronically, right? And a lot of times the doctors don't have the time to go through all the different things. There's HIEs that might be connected that, the data there that, may not be seen. And the augmentative piece, just for again, it's like somebody go fetching articles from the latest journal. It can be relatively easy to do that, right? To support whatever it is that you're looking at. But then the decision making part is, I think, where that hasn't been proven out, and I think that's where the FDA is looking at the clinical decision support tools, right, that are available. It's interesting because again, it's a difference between making a decision and providing the data that can support a decision, right? There's lots of databases out there. So First Data Bank is one of them, right, which has all the pharmaceutical information and all those little prescriber inserts and things like that. So it has all the side effects and everything, and then potential interactions and summaries of the clinical trials. That information is obviously not easy to get at when you're prescribing something, and certainly not at your fingertips when you're thinking about like, oh, somebody has high cholesterol, what should I put them on,
Yeah.
given that they have X, Y, and Z, right? And then as we start getting more genetic information, which will help us understand how drugs get metabolized, the ability to research a database like First Data Bank very quickly to be able to come up with the most safe therapy for that patient is going to be really critical, right? Because you don't want to obviously put somebody on a drug that potentially has interactions with other things that they're taking or is
Right.
metabolized differently and things like that. So in that situation, I think the augmented slash clinical decision support that can be provided by having these databases available that instantaneously will listen in on what you're saying and
Mhm.
come up with suggestions, and highlighting those areas where this may be an issue, I think will be very helpful. Again, it's not a direct connection to the patient, but it's helping the doctor, the human,
Mhm.
make more informed choices. I think that's how we can look
Mhm.
at least at this point, how AI can help, right? The industry wants to go to a place where you have AI providers, right? Providers that have,
The full autonomous,
yeah,
yeah,
been trained.
application.
I mean, so it's still like, how nurse practitioners and physician assistants are supervised by a physician, and they generally could do most primary care things. They have enough experience doing that. But legally and by regulation, they have to be supervised by a physician in most states. And there's some states that have autonomous nurse practitioners, which is, obviously up to each individual state. But so I think what the industry wants to get to is AI providers, right, that are driven by conversations that have been had between a patient and a physician in order to glean what a physician might say in a particular situation. That's something that the FDA will definitely want to regulate, because that is making a decision without the intervention or supervision of a human directly in that situation. So
Yeah.
augmentation, I think, is different. So having a database that's available and
Yeah.
searchable by AI, and you could think about, I mean, AI is really, an advanced Google, right? To do
Right.
search, you do
Yeah.
searching across large data sets and matching things between two data sets, right? The patient's data set and what the literature says.
It seems pretty far away that the AI would be practicing autonomously. But I could,
Well,
I'm sure we could be surprised by how fast AI is advancing.
yeah, I think I don't think the FDA is ready to approve or any type of autonomous
Mhm.
AI agent to act as a clinician, right? You can certainly probably tee up patients in this way for the physician to then do a review. So it could be sort of an advanced augmentation, right? So imagine you are, seeing it, you want to you call up and you want to see a doctor on the internet, and they take all your information and they have access to your EHR, they have access to data. The AI will ask the questions that a physician would ask, so that way they're lining up the patient. Now, again, in that situation, it's going to be biased, right? Because it's based on what the physician was trained on, would typically ask. So if somebody says, I'm vomiting, yellow vomit, and then my eyes are green and haven't been sleeping, and I take these pills, it will sort of look through all the things that this physician has done in those situations and then apply the same questions. They'll say, oh, okay, well, did you eat seafood the day before? Or did you, all those kinds of things that they would typically ask. So it's mimicking what the doctor would do. You can imagine that this patient is just sort of lined up in the next queue for the physician to pick up and say, oh, hi, Mrs. Smith, I see that you're vomiting yellow vomit, and your eyes are turning green and all this kind of stuff. Based on what he or she's done in the past, this is exactly how this patient would present. That being said, it would be more robust if you did this across, let's say, hundreds of thousands of patients, and that way you have a better idea of whether or not that algorithm that that one physician has created through his
Mhm.
conversations is actually the best route, right? Or what is the best thing to
Yeah.
do?
Is that application being applied today? From what I've been exposed to, I know some level of AI augmentation happens at least at the call center level where with physicians, I'd imagine like cross-covering patients, if then the AI is able to kind of process all the history, could this help simplify
It could,
that?
again, it would depend on your trust of how it's summarizing and what the data it's actually accessing, right? So, one of the issues with this technology is that not everybody has the same amount of data available. So, you worry about hallucinations, you worry about, if the AI is actually summarizing the right data. And so I don't think people are using it to that extent. I mean, when you mentioned that call centers are using it, yeah, that's a relatively small data set, right?
Right.
Appointments, what is the level of severity of that particular patient, which is there are lots of algorithms that are already created to do that. And EHRs are already reminding physicians about what to do, right? They're saying, patients alert to something, but it turns out that those aren't that smart in the sense that
Right.
it will keep on reminding you of things that you already know, and then eventually you'll turn it off because it's so annoying because you can't even get to what you need to do, right? So I think what AI might be able to do is clean up those alerts so that there are smart alerts. In other words, if it says that, oh, this patient is due for a mammogram, but it knows that you ordered a mammogram last time, then
It
it will
won't.
remind you that this patient is due for a mammogram because you're waiting for that thing to happen, right? So those kinds of things I think can help clean up the alerts, right? And then you can still apply the algorithms, which aren't independent. Like you personally, or the society has come up with an algorithm like, hey, for this particular condition, once you've figured out that the patient has X, then you do Y and Z. Those kinds of things I think can help, right? And to clean out the false negatives, so that way you're not encumbered by all the noise, essentially. But there's still danger, right? There's still danger that
There
it
is, yeah.
misses something, right? AI will miss things, I think, just like humans will, because humans are programming the AI. I haven't seen any case yet where the AI's found something that wasn't necessarily programmed. Although that being said, if you look at what AI has been doing in radiology and detecting, tumors and breast cancer and things like that, that's been amazing. But I think there still is. It's just a matter
That
of
application, is that still augmentative?
that's correct. Yeah, but usually what happens is then you do a confirmatory imaging test, right? So typically
Right.
what you'll do is you do, mammogram, which is plain X-ray,
Mhm.
and because the breast tissue density is different, that's the noise that you're trying to wash through to see the actual tumor thing. And then when an AI picks up a pattern that suggestive of a tumor, you might then go into an MRI or do a biopsy, that kind of thing. Probably another imaging test, not necessarily a biopsy, because that's obviously invasive. But yeah, I think there's definitely cases where it's a limited field of information. So a mammogram, there's only, that's pixels, right, on a screen. So you're really looking at pixel patterns at the end of the day. Combine that with history of pixel patterns. So the idea is that if you have a mammogram, every year or every other year, then you that's what radiologists do. They look at the previous years and then they compare it to this year. And computers are really good at being able to match pixels, right? And that I think it increases the accuracy of the view.
That's super helpful. I mean, in the area of radiology, like what I've heard is it's just been tremendous. That wraps it up. Stay tuned for our next episode.